Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes. Welcome to the Tongue Tie Experts Podcast. I'm Lisa Palladino, a registered nurse, midwife, and lactation consultant with over 35 years of experience, and I'm grateful that you're listening today. This podcast is for families impacted by tongue and lip ties and for the professionals who care for them. Whether you're a parent looking for answers or a professional who knows there is more to learn than what many of us were taught in school, you are welcome here. I hope each episode helps you feel a little more informed, a little more grounded, and a little less alone. My own clinical work is centered on infants and breastfeeding, but these conversations often reach beyond infancy because function matters at every age. Together, we'll talk about tongue tie, lip tie, all stages of feeding, oral function, airway, and how we can support families with more clarity, confidence, and compassion. I'm so glad you're here. Let's get into today's episode. Hi, everyone, and welcome back to the Tongue Tie Experts Podcast. As always, I'm your host, Lisa Palladino. And today we have another IBCLC joining us, which is, to me, really exciting because I've been interviewing a lot of different professionals in different niches, dentists, body workers. I haven't had an IBCLC on in quite a few episodes. So we have Katie today. Katie Oshita is an RN, BSN, IBCLC with over 25 years of experience working in maternal infant medicine. Katie sees clients locally in Western Washington. She is also a telehealth lactation consultant, believing that clients anywhere in the world deserve the best care possible for their needs. Being an expert on TOTS, Katie helps families everywhere navigate breastfeeding struggles, especially when related to tongue tie or low supply. Katie is also passionate about finding the root cause of symptoms using functional medicine practices to help clients not only just survive, but truly thrive. Welcome, Katie. Thanks so much for being here.
Thanks, Lisa. I'm happy to be here today.
And we have a lot in common just from our bios, I can tell, because I'm also trained in functional medicine. And on the other side of my practice as a midwife, I help women with issues like low milk supply and thyroid and fertility or fertility challenges and things like PCOS, which has just been renamed. There's a new name for PCOS.
Is it PMOS?
Making it more of an endocrine disorder as it deserves. So anyway, and we both have a lot of experience and we both have a podcast, right? We didn't mention that in your bio, but you have a podcast as well, right?
Yeah, Katie the Traveling LC.
The traveling, that's great. So where have you traveled to? What made you do that? Like, that's so cool.
So if you go back to COVID, when everyone was saying they had too much family together time and they were all going insane, we decided to take it one step further. And instead of living in a house being trapped inside, we decided to sell our house and live in a tiny RV.
Wow.
And took my kids who were, at the time we started traveling, about 10 and 12. And we started traveling the country. We hit 40 states and 3 Canadian provinces in 2 years.
That's pretty impressive.
It was amazing. Personally, we got to see things that I never would have seen. We spent a month in New Orleans. We got to see the wild horses at Assateague and went to Montreal. And, you know, we saw tons of things that we just wouldn't have been able to if you're waiting for a vacation once or twice a year.
Right.
But
and the kids were out of school anyway.
We were homeschooling.
Right.
Yeah, so we were homeschooling or road schooling, as people say. And it was really fantastic because, you know, we want to learn about history. Well, go to Yorktown, go to Gettysburg.
Right.
We want to do science. Let's go to a national park, you know.
Right.
It was really fantastic. And
I homeschooled my daughter for 2 years, and she had a fascination with Ben Franklin. And we're near Philadelphia, so we went to the Ben Franklin Museum and did a lot of hands-on learning there. You know, what better can you do than learn the actual artifacts, right?
Right. And to see it, feel it, touch it, to be out there and to be standing on ground that was where things happened. It's much more moving than reading about it in a history book.
And do you have a favorite place?
I would probably go back to New Orleans and any day. We were supposed to be there about 2 weeks, and we wound up spending a month. Definitely the longest we spent anywhere. On average, we typically moved every week. So a month somewhere was very luxurious. Such amazing culture, food, community, language. It's just a really fantastic place. I really like New Orleans.
Yeah, a lot of good
music.
We
were there in winter,
art.
though.
Yeah.
And even then, in December, I think at Christmas, we had like 85 degrees. Definitely not used to that from the Pacific Northwest. But it was really lovely. I don't think I could handle their summer with the humidity and everything, but it was lovely.
Yeah. Oh, that sounds amazing. Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, the Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear, and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes. So, did you keep your podcast going while you were doing that?
So I started podcasting when we started traveling. So it happened because I realized that I was literally going to be driving by all these amazing practitioners, all these people I wanted to meet, and I didn't really know how to get out there. I'm not super extroverted, so it was hard to take that step and meet people. And my husband suggested the podcast, and at first I thought he was crazy, and it did probably took me a good year to feel comfortable doing it. But it has been fantastic because it was my step in. It was my way of meeting people and being able to go to, to Alabama Tongue Tie and see Baxter, or to go see Kotlow, or, to meet people who are maybe not the big names, but doing amazing work in their community. And to go and see these people and to watch them do releases or do body work and talk about lactation. It was fantastic. So it was funny because in a lot of ways, we chose to travel, and I thought it was going to hurt my practice. I really thought, this might set it back, but I was valuing family at that time and felt like it was the right thing to do. And in reality, it was great for the family, but it really actually elevated my practice, and it helped me meet so many providers and learn from them and not stay in my tiny bubble of like, who's in my town, who's practicing here. And now a lot of my recordings are with international guests. And I love hearing about what's happening in other parts of the world. What's the same, what's different, what's new and exciting. So
Yeah,
it's
same. Yeah, I love the idea of meeting people through podcasting because that's the model I've done too. And then when I do get to meet the people in actual person, it's really fun. So we had the opposite experience because we went to ICAP together. For those who don't know, if you live under a rock in this field, you wouldn't know what ICAP is. It's the International Consortium of Ankylosing Professionals, such a long term.
long name.
But we'll call it ICAP. And we went to the conference and we met there. And I also met up with a lot of people who I had interviewed who I had never met in person, or I'd met briefly in person or heard their lectures or whatever. So that was, for so many reasons, ICAP was such an enriching experience. Sure you agree.
Absolutely. Like I'm honestly, it was so much better than I expected. I was floored with how fantastic it was, how much learning, creativity, really collaborative attitudes, right? We were asking each other questions, but not in a challenging, judging way, in a curious, tell me more. What happens if you do this, right?
Yeah, I love that. I love that about ICAP because, and what you said, that it was better than you expected. That was the first ICAP you went to?
Yeah.
Yeah. So almost everyone going to their first ICAP has the same reaction. And I think it's because it's hard to imagine how much better, and I'm not dissing other conferences, but how much better it is than other conferences because of the way the interdisciplinary focus is more in this conference than other conferences. And the respect among the disciplines is unique in this world, in this conference. So I had to leave and miss the last days, and I was just listening. I just started listening to the recordings, and I'm like, wow, I wish I was in the room. Like, I'm still thinking of questions and I'm jotting down notes. And like, sometimes you go to a conference and you hear things and you're like, yeah, ho hum. Every talk I was at, including the ones I'm listening to now, are making me think, stimulating my brain and thinking of new creative ways to either change practice or talk about things in different ways, right? So it was
absolutely
really cool.
I came home. So when we got to the conference, I sat down, opened a Google Doc, and took notes. And I did add some photos of of the speakers and any of the slides that we were allowed to take photos of, where it was like a graph or a chart, something I wasn't going to be able to get down well. I came home with 47 pages of notes in my Google Doc. And my first thing was to make a staff meeting with my contractors, my other lactation consultants, that say, hey guys, I have to tell you all this stuff.
Yeah.
You have to learn some of this. It is mind blowing. And I do think that what makes ICAP amazing is that interdisciplinary, but also it's the international. It is getting out of our little zone and not staying in what is my city, state, country doing, but what is the world doing? What are other practitioners seeing, and how are they changing this, and how, what does it present like for them? What are their obstacles?
Also seeing that some people in other countries are doing things completely different and still having good results.
Absolutely.
Right? So like there's a lot of ways to get good results, and you have to practice within the culture that works for you, within what's available to you, and also be open to hearing that what we may do here may not work somewhere else, even if they had the same availability of tools and techniques, because it's a whole different culture. And that's pretty fascinating. And also, what else I get from ICAP? Most of the people, with a couple of exceptions that might have really big egos, most of the people are very willing to hear why somebody does something differently and reflect on that and see if that would work for their own practice. So resiliency in our practices is so important, especially in this field.
Yeah, absolutely. And I think there were I was surprised, honestly, that it felt like there were very few big egos in that room.
Yeah.
I think what stands out to me as some of the highlights from ICAP, first and foremost was Dr. Scott Siegel talking about complications. I felt like he was brave.
Yes.
And I think in some ways I can also see that maybe when you have so much success in so many years, it can be easier to stand up. But I also feel like that sends a message to the younger people coming into the fields. And it shows them that we need to talk about these things. Nobody has 100% success rate.
Right.
And that applies even within lactation. I meet lactation consultants all the time who are like, oh, every tongue-tied baby I work with has perfect function afterwards. And I'm like, wow, where'd you get your Harry Potter wand? Because mine hasn't arrived. Like, nobody is perfect.
Right. And they're not following up if they think that's true. Because that's...
Yeah, exactly. Right.
Yeah.
Or they're just not acknowledging something's going on.
Yeah.
So I thought that was really brave. I thought that was, very fantastic. I was also blown away by Stefano Colasanto's talk and the work he's doing, looking at he's an osteopath and a dentist, which, I mean, how many of those are in the world?
I just want to adopt him,
Right? I'm like, how? I'm like, can I come practice with you? Like, how is someone an osteopath and a dentist?
Right.
Amazing. But the work he's doing, looking at like the pupil size with people with tongue posture was shocking to me. And I actually thought about it the other day because I was at a physical therapy appointment with, I have some hypermobility issues. And the physical therapist said to me, not knowing, that I work with tongue-tied babies and everything, he said, try to raise your arm. And I was working on my shoulder. And he's like, okay, now I want you to put your tongue up on the roof of your mouth and try again. And I just laughed. And he's like, why? He's like, it matters. Like, your tongue posture affects your body. And I'm like, no, you don't understand. I was like, you don't have to sell me on this. I'm amazed that you know it.
Right. That's so impressive, right? We're getting the message out to the world, right? That these things are true and true. So interesting about eyes. And I've had private conversations with him about this because I was born with strabismus strabismus developed, who knows, because of my tongue posture and the way I was raised. And, I don't want to go into gory details, but everything was done to me against having a healthy airway. Let's just put it that way. Okay. So, but I also had this strabismus that wasn't picked up, but my mom kept saying there's something wrong with her eyes. They drift, and they drift when she's tired, and nobody could pick it up. So I was doing some kind of compensation that wasn't picked up. So also my left eye was mostly affected, and everything on my left side, when people examine my fascia, that's my bet. Like it's twisted or something, right? So I've had surgery because I had left-sided sciatica. Like everything's on the left side, starting with my eyes, right? So to me, having people say this, then it just, all the pieces are fitting together. And what do we do with that knowledge? How do we get that to people to understand? And having someone as credible as Dr. Colasanto is a great way. And I'm really hoping to have him on the podcast. I really want to go visit him in Rome. So if you ever want to have that kind of travel trip.
Me too. I know I'm already trying to figure out how I'm going to make Zurich happen next year. Because that conference is going to be amazing as well. And I'm like, can I hop from Zurich to Rome? We'll have to see. Yeah. It's a lot closer than when you're all the way over here in Washington. But I think what I liked about his pupillometry study was that it gives a clear, measurable data. So much of what we do is not measurable and clear, especially for us with babies, right? Like, yes, I can measure if they transfer better, and we can have the parent do a scale of, pain level and stuff, but it's hard to measure some of this, like, effectiveness of transfer, the ease of feeding, the feeling of success for the parent, all this type of stuff. It's harder to measure some of this. And so for him to be able to show in adults and older children the effects of tongue posture in that pupil size felt very clear. It felt like something that other providers could look at and go, oh, wow. So this tongue posture thing really matters, right? And it wasn't about...
And pupil size, because that's not something you can control. It's not, right? So
even
the height studies...
to dilate your eyes on demand.
Like there's some heights where you could see the person looks taller after And Dr. Kaplan has demonstrated that a lot in his photos when he lectures. But you can stand up taller. You can't change your pupil size, right?
Right.
Yeah, it's so amazing. And getting more into what you're saying about having the data, I love what Sirius is doing, which is the research arm.
Research arm, yeah.
And some of the things that I just listened to today that Dr. Singh was presenting about actually proving most of the time proving what we know in our hearts. Like that's how I feel about this. Like there's certain trends that we know and we think it's the right thing and we hope it's the right thing, but there hasn't been enough research. There's just evidence based on what we've been doing for years, right? Which is evidence enough, but then to see it like mapped out in numbers and statistically using, validated tools to track it, to me, it's like, wow, we finally, hopefully, will be respected for what we are doing and not to be afraid to change our practices based on what it shows. Like one of the studies that he was talking about, which isn't published yet, it's data he's working on, is the difference, the people who say, should we release a tie to prevent future problems? And if everything is going well, I say all the time, no, we should never, if everything is working, there's nothing broken, we don't try to fix it. And his preliminary data is showing that's true. He doesn't see that much difference in speech and feeding issues in older toddlers or young children based on whether they were released as infants. So it's like there's not enough evidence there to make it a study, but at least it's trending towards what I say to my families that come to me or people who ask me, right? So that's always wonderful. And then the other thing was about, this whole aftercare. And I have a whole episode on aftercare coming out. It's probably going to come out before this, but all about how do we prevent reattachment and what is the right aftercare? And there is data now showing that there is a difference between if you don't do any stretches or you do stretches in success of the procedure. So that is exciting to me too.
Yeah, absolutely. I found that part fascinating, and I came home after I kept wondering how I could wind up doing research, and then I realized I don't really know much about research.
Right.
I have to learn a little bit more here.
Right.
At the very least, I can be a follower of all this research and participate that way and promote the research that is coming out. But it is exciting, right? There is a massive lack of evidence and studies in when you talk about maternal medicine, infant, lactation. Like we do not have enough studies. We have a lot of studies on adults. We have a lot of studies on men. We do not have enough studies on lactation and tongue tie and all of this. So it is exciting to me to be working and to see evidence coming out in these areas that's so needed. So needed for the population and for the practitioners like us who are out here trying to do what we think is best in using evidence-based medicine, but to have some data backing us up is going to be fantastic. So I was very excited about those studies as well.
Me too. And then the other thing I wanted to be sure to ask you about, Katie, or that we should talk about is telehealth and the challenges of telehealth and the advantages of telehealth, because we are both right now telehealth providers. Another thing we have in common. I had an office for many years, and I moved a year and a half ago, and my office isn't available where I am now. So I am just doing virtual consults, and it's working for me. And tell me about how that works in your practice and why you think it's important.
Yeah, I've had years where I've only done telehealth. I'm mixed, but now, and I'd say on any given month, I'm still 50% or more telehealth, 50 to 75% telehealth. I like telehealth. I personally like it as a patient. I think it's easier than driving off and finding parking and dealing with traffic and getting to the doctor's office. for most things. There are times when being in person helps, but there's a lot of times where it's unnecessary. So what I tell people is that the biggest thing that I can't do is weigh your baby. But guess what? There's a lot of ways to figure that out, whether we're going to the pediatrician's office, whether we're going to a free baby cafe that might have a scale. There's trend weights are great. We don't always need transfer weights. So there's a lot of options. But I do think telehealth is the best way to get the right practitioner for you. Right? So you don't have to be seeing who is in your neighborhood, because they might not know the answer to your issues. They might not be specialized in what you need.
Right. And also, I've had the great opportunity to be able to know people in different neighborhoods, so that if I need to refer someone to someone in person, whether it be another lactation consultant or a speech language pathologist or a body worker or a dentist, I know, I have a network now, so I can say, well, you should go see this person. Like, for example, I had a family yesterday, and the baby is spending a lot of time swaddled, and they're very concerned with the baby's startle reflex. And I did a lot of education about how the longer you keep that baby swaddled, the less likely he's going to integrate his startle reflex. So I was able to refer them to an OT who does in-person classes in their neighborhood, who also does craniosacral therapy and is familiar with tongue ties. So that worked out beautifully, and I hope and pray they go, and we'll get the in-person care, because there's certain things you can't physically do things. I'm very frustrated with not being able to examine and help mom's position. Like, I have a doll, I call her my ugly baby doll, that I try and position. It's a very floppy doll, and show mamas how to hold the baby differently than they are holding the baby, and
I've got all my
what that's
props
supposed
here
to look like. Yeah. So there's ways around it, and it's very valuable. I have to be honest though, I'm very hands-on. I'm a midwife, so I'm very hands-on. Sometimes I'm frustrated because for so many years I was so hands-on, and now I'm like, okay, I can't. All right, how could I work around that?
I think it also takes longer. It takes longer for me to tell you how to position yourself than it would be if I did something. But I think it's better. At least for me, I find that because I can't be handsy then, right? Yes, I can position a baby to get them in a better latch in the office. That's not a question. But is that going to help the patient?
Right.
Is that parent going to go home and be able to recreate that? They didn't do it. Right? And in theory, hopefully you help them on the first side and then they do the second, whatever. But it doesn't always work out that way. So when I'm virtual, I find that the learning curve is faster for the parents, right? They're picking up on that stuff faster because they're doing it the whole time. I use my doll and I show rhythmic movements and oral exercises. The parents are the hands doing it the entire time. Doing an assessment on body tension or reflexes. The parents, and I will explain, what we're looking for, how we want the baby to lay, all this stuff. The parents will quickly say to me, oh, look, this is off. Oh, this hip feels really tight. Oh, I can't get this arm up. And
then they're learning about their own baby in ways
and they're not afraid to do the things. If I'm in the office and I'm showing all of the things on their baby, and I don't, whether it's time or whatever, don't get them to practice, they go home and they don't know what to do. So in a virtual consult, they know what to do because they've been doing it the whole time.
Right. Yeah, it's really, it's an art, and it sounds like you're really good at it, and I
do love it.
Yeah, and if I had my choice, I would be doing more in person, and I'm thinking about places I can do it now, but I am getting better at the virtual, and I do know that they're getting, so the patient doesn't know the difference that I know when I'm doing the virtual. For me, it's my own biases against what I'm used to. So, but I'm getting there. The patient doesn't really, they don't know what would have been different I was there. It's my struggle to create that environment that I'm used to in a virtual, not in the same room. But I also like that I get to see, because I wasn't doing home visits, I was doing office. But now I get to see their home, the environment, the place they're nursing their baby. I had a family who was in their bedroom, and I was like, well, what is there any other place do you nurse? And like that just brought up a whole conversation about social attitudes and family members, and brought in so much more of a conversation than it would have been if they came to my office. I wouldn't have seen what the environment is and what the challenges are for them in their environment.
I've seen things like a snoo when they didn't tell me, and I have a specific question on my intake. Are you using a snoo?
Right.
Hadn't been filled out, and I see one, and they're like, "Oh yeah, my sister just gave it to me yesterday," and I'm like, "Let's talk about that." Right?
Yeah.
So exactly, you'll see things that you wouldn't see in an office visit. So and for me, my in-person visits tend to be young babies. Typically, a lot of times those are under 2 weeks. My office is in a birth center, so I'm starting with very early babies. Most of my virtual consults, on the other hand, are older babies, 3 months up, 6 months up, things like that. So it's very different. A lot of times we are not as weight focused, or if we are, we're at the point where weighing once a week is adequate, right? We're not talking about a 4-day-old. And it's a very different story. And when I meet someone with a 6-month-old who isn't gaining weight well, or is, they're struggling with their supply and thyroid issues or whatever, it's a very different feel as well. And I love those visits. I love my virtual clients.
Yeah. Well, you're doing great work. Thank you.
I love it. It's so fun. And I've had clients globally, and it's really fun to get to see, what is it like in Costa Rica or Germany or Australia? Like, how can I help you across the world and facilitate? And part of that comes from things like ICAP.
Right.
From knowing providers, knowing who to reach out to, and building that network.
Yeah. And the other thing about ICAP is it's just so much fun because I just lost my last fairy hair.
I lost one yesterday too. I'm getting very low. I still have a couple left. It was fun.
So for those who don't know, and my family was totally stumped by it, even though I've had it before. Fairy hair is a tradition that goes back to just lactation conferences where a few ladies know how to weave in sparkly hair. It looks like fairy hair. And it's a tradition. Shout out to my friend Mary Lou, who was doing it at ICAP. And because my kids were like, even my grandson's 4, he was like, "Grandma, why does your hair look like that?" I'm like, "I have fairy hair." He's like, "How do you get fairy hair?"
Yes, I had teenagers who were like, "Is there somewhere around here who can do that for me?" And I'm like, "I have no idea."
That's fun. Okay, Katie, I want to thank you for, first of all, for stopping by my table at ICAP and we getting to meet, and for taking this time to be with us today. And I'm sure my audience will enjoy this conversation as much as I did. Where can people reach you? Your website?
So my website is cuddlesandmilk.com.
Okay.
So that's my private practice. And I also have my podcast, Katie, the Traveling LC.
Okay. We'll put those links in the show notes for anybody who wants to connect.
Thank you so much. It was great to be here, Lisa. Thank you.
All
for
right.
having me.
Hopefully you'll drive by someday soon and we can hang out.
Yeah. Only when it's not 95 degrees.
Yes.
I don't do heat. Okay.
All right, Katie.
Thank you. Have a great day.
This podcast is meant for education and conversation only. It is not medical advice and does not replace formal education, professional training, or individualized care from a qualified healthcare provider. Always seek appropriate guidance for individual concerns. The views and opinions shared by our guests are their own and do not necessarily reflect those of the host or tongue tie experts. Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes.